How is bone tuberculosis diagnosed with biopsy? Have you ever wondered how doctors diagnose bone tuberculosis? This process is quite detailed and involves several steps to ensure accuracy. Bone tuberculosis, or bone TB, is an infection caused by Mycobacterium tuberculosis, the same bacteria responsible for pulmonary tuberculosis. When it comes to diagnosing this condition, a biopsy is often essential. The first step in the biopsy process is to collect a tissue sample from the affected bone or surrounding soft tissue. Doctors typically use a fine needle aspiration biopsy or a core needle biopsy. The fine needle aspiration biopsy is a minimally invasive technique. A thin needle is inserted into the lesion to extract cells or fluid. For deeper bones, like those in the spine or pelvis, imaging techniques such as computed tomography or ultrasound help guide the needle accurately to the target area. If the needle biopsy does not provide clear results, an open biopsy may be necessary. This involves surgically removing a larger tissue sample for examination. Once the sample is obtained, it undergoes a histological examination. This means the tissue is looked at under a microscope to identify specific features of tuberculosis infection. One key characteristic is the presence of granulomas, which are clusters of immune cells that form in response to the infection. However, it is important to note that granulomas can appear in other infections too, so they are not definitive proof of tuberculosis. Next, microbiological tests come into play. One common method is acid-fast bacilli staining, which helps detect Mycobacterium tuberculosis in the biopsy material. If the test shows positive results, it supports the diagnosis, but it is not always conclusive. The gold standard for confirming tuberculosis is culturing the biopsy specimen. This allows the bacteria to grow in a lab setting, making it easier to identify and test for drug susceptibility. Studies have shown that culture positivity rates from bone biopsies can be quite high, often exceeding 80%. In addition to these tests, molecular techniques like polymerase chain reaction can quickly detect tuberculosis DNA in the sample, increasing diagnostic accuracy. However, the availability of these tests may vary by location. Finally, the results from the biopsy are interpreted alongside clinical signs, imaging studies like X-rays or magnetic resonance imaging, and other laboratory tests. This comprehensive approach ensures that doctors can confirm the diagnosis of bone tuberculosis accurately and rule out other conditions that may present similarly. In summary, diagnosing bone tuberculosis with a biopsy involves collecting tissue samples through fine needle aspiration or core needle biopsy, examining the samples for granulomas, conducting microbiological tests, and interpreting results alongside other clinical information. This method is minimally invasive and effective, often eliminating the need for more invasive surgical procedures. If you suspect you have bone tuberculosis or have concerns, it is essential to consult with a healthcare professional for personalized advice and treatment options.